Welcome to Wednesday Night Study Live here on Tisha Talks Mental Wellness, where we gather to complete addiction counselor exam study questions. Welcome. If you're new here, I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. Over here on Tisha Talks Mental Wellness, I make substance use and mental health education and training content, in addition to addiction counselor exam study prep videos. So if you are preparing for any of the top 5 addiction counselor exams, including the ADC, the AADC, the NCAC1, NCAC2, the MAC exam, any of the certifications, you are in the right place. Even if you're still in your program, you might be in a counseling program or you might be in college taking an addiction counselor or addiction related course, you're also in the right place. Come on in. Thank you for joining. I hope everyone is well. Let me look at the chat to see what y'all got going on. Good evening, Doreen. Hello, hello, hello. So when you join us on our Wednesday night study lives, typically it's 1 hour. But for the month of August, if you're watching now, we do 3 hours. So we're doing an intensive. We gather here, we complete practice questions where I ask the question, read the answer choices, pause, give you an opportunity to put your answer in the chat. Then I reveal the answer and I give explanations to both the correct answer and incorrect answer. If you're able to, I suggest you have a pen and paper. That way you can write down any topics that you feel like you need further explanation, and you can make your own study notes. That way you are reinforcing what you are learning. So our questions are all addiction counselor exam topic related, and it helps us strengthen our exam confidence because most of us are preparing for some type of licensing or certification exam. And it also supports improvement in our clinical reasoning because that's what we do as addiction professionals. Ways to support this channel. You can like this video. So if you are watching right now, and hello to the playback. If you missed the live, no worries. You can still watch the video and complete your study time. Like this video. Also, make sure you're subscribed so you can get updates on lives and any resources that I have. Also, liking the video and subscribing to the video puts us in the algorithm so we can meet other study partners and the video can reach out to other people preparing for addiction counselor exams. Watch the video to the end. First of all, you need your study time in, right? And also, that also helps put us in the algorithm so other study partners can find us. We've been doing pretty good, you guys. We're almost at 3,000 study partners. Pretty good, right? Yeah, we're all over the place. This is our little corner of the internet where we are counselors, addiction professionals, and we are just getting ourselves together for our certifications or just learning, sprucing up our clinical abilities. You can also share this video with someone who is interested in addiction counselor topics or who is preparing for an exam. So lots of us are already working clinicians. So share it with your clinician colleagues or someone you know that might be interested in addiction counselor exam topics, or they may be preparing for an addiction counselor exam and they haven't found us yet. You can hype this video. If you're on your mobile phone, at the bottom, it'll show you something like with a star and it says hype. So that's like giving me a hand clap or a pat on the back and letting other people know, hey, this is a great video. During the live stream, if you would like to send a super chat, you can do a super chat. If you'd like to send a super thanks, the button is under the video. So even if you're watching the playback, you enjoyed the video, you thought it was helpful, you can do a super thanks. Also, I have links to Buy Me a Coffee, PayPal, and Cash App if you like to support the channel monetarily. All right. So hour 1 is going to be on drug misuse, addiction, and substance use disorder, the symptomology. Let me check the chat to see who's in here before I get started. If you can hear me clearly, chat, please put a 1 in the chat. Letitia Banks. Hi, Tisha. I passed the ADC yesterday. Awesome. Thank you for studying materials in the videos because they were helpful. Thank you so much and appreciate you. Best wishes. Congratulations. We have great news already, you guys. We also had two other people who passed over the past week. Let me make sure I shout you guys out. And I think both comments were under the supervision video. So whenever you get a chance after we finish tonight, go under the supervision video. We had two, now three. So now that Letitia has passed, we have three that passed over the last week. Congratulations. It's like such a relief, right? I'm glad you said that at the top of the hour because I surely was going to forget. Okay, so MVP campaign says, pass my test in Texas today. Study a week. Just using your videos. Thanks a lot. Thank you, MVP campaign. Best wishes on your career journey. Also, Jesse Dominguez, 5803, says, I have failed this test twice before. After listening to your videos, I felt like I understood everything on the test and was able to finally pass the test. Thank you so much for these videos. Thank you for updating us. Congratulations, Jesse. I appreciate all of your support of the channel, and best wishes on your career. And as I say always, we all can pass. Even if you're here and you failed a few times, you're gonna pass too, because I believe you're gonna take it until you pass. Thank you guys. Congratulations, everyone. And I appreciate you for updating us. You guys update me when you fail, when you pass. It's all helpful. All of that information helps me to improve the study material because I'm still learning too, guys. I don't see myself as the teacher. I'm the facilitator. Remember, I passed the NCAC one in 2016, 2018, almost a decade ago. So as I'm developing study questions for you guys, I have to go to the exam websites and see if there are any updates. I'll make sure I'm providing the correct information. I have to spruce up on my own knowledge because remember, I do a particular job every day. So a lot of this stuff I don't use. Like I've never worked inpatient. I've never worked at a MAC clinic. So I'm studying along with you guys. So pat on the back to all of us. All right, I see your ones. Let's go ahead and get started. That just gave me a boost of energy, y'all. Letitia passed her test. Letitia passed her test. All right, camera down. Let's focus. All right, and as a reminder, you guys, you can screenshot this or you can find it under the community post tab on our YouTube page. And I also send the same graphic out on the email reminders. If you want to join the email reminders, you can download the free resource at my Stand store. The link is in the video description. Remember, if you're placed on my email list, I send you a reminder email once a week, or if there's any additional updates with the channel or videos. All right, symptomology. So hour one will focus on symptomology, meaning signs and symptoms associated with a substance use disorder or addiction or drug use or misuse. We'll review addiction, substance use disorder, signs and symptoms, including tolerance, withdrawal, cravings, loss of control, and continued use despite consequences. So anything you can think of in terms of what would be the signs someone has a drug addiction, and can you be able to tell the difference between when someone uses a substance, misuses a substance, is showing signs of having an addiction, or if they meet criteria for a substance use disorder. We'll be more specific in hour 3 because hour 3 is going to be substance use disorder questions, but we'll dibble and dabble in that in this hour as well. So, what to know in terms of symptomology or symptoms of substance use disorder or symptoms of addiction? You should be familiar with the common signs of a substance use disorder, including cravings, loss of control, continued use despite consequences, tolerance, and withdrawal. You also want to be able to understand severity of substance use disorders and use, including mild, moderate, and severe based on the DSM-5 criteria. Also, you need to be able to recognize symptoms in client scenarios. So, as the addiction professional, you need to be able to distinguish between when someone has misused a drug or a substance or when they are showing signs that they have an addiction and they have a substance use disorder. The question may describe a client who's experiencing symptoms, and you need to be able to identify the symptoms and recognize a pattern that's either problematic or determines that they have a substance use disorder. So the skill. So the skill that you're being tested on, typically on addiction counselor exams under symptomology, is applying your knowledge of symptoms and next steps. That means, as the addiction professional, you're being tested on recognizing symptoms when they're described in a scenario. You also want to know when you need more information. Sometimes the best answer isn't making the diagnosis right away. It's simply just making the best decision for the client's safety and health. Question 1. A client reports that his alcohol use has gradually increased over the past year. He states that he now drinks more evenings and sometimes feels restless when he does not drink. He also reports that alcohol does not seem to affect him as strongly as it did when he first began drinking regularly. Which finding most strongly indicates the development of tolerance? A. Drinking on a more consistent basis. B. Feeling restless during periods of non-use. C. Experiencing less effect from the usual amount. Or D. Increasing alcohol use during stressful periods. Which one strongly indicates he's developed a tolerance to the alcohol? Okay, I see some C's. Oh, I passed my CSAC exam this past Sunday. Thank you. Congratulations. The correct answer is C. Experiencing less effect from the usual amount. C is correct because a noticeably reduced effect from the same amount is a key indicator that of tolerance. A is incorrect because increased frequency can indicate a change in the pattern of use, but does not alone establish tolerance. B is incorrect because restlessness during non-use may suggest withdrawal symptoms and would require further assessment. And D is incorrect because increased use in response to stress may reflect coping-related use or impaired control, but does not specifically establish tolerance. So what is this test question asking you? It's asking you to be able to distinguish between when a client has built up tolerance from other symptoms that may occur as substance use progresses. So as addiction professionals, because we're the professional, we're the specialists, we may see a particular type of use as problematic, non-problematic, quote unquote, normal for the context of which a client has reported it. And we need to be able to tell if the client needs immediate care, no care at all, psychoeducation. We need to be able to identify what the use says, the pattern. The skill that's being tested with a question like this, recognizing and differentiating substance use disorder symptoms from other clinical symptoms. So again, we will see clients, they're going to ask you questions, or you may get questions about a client, let's say increasing alcohol use because they're grieving, they just lost a spouse. You're going to have to be able to distinguish between that being a coping strategy, maybe not the most helpful, but it's a coping strategy, but maybe they don't meet criteria for substance use disorder. So that's what this type of question is trying to see if you understand those concepts. Question 2. According to the DSM-5, which of the following criteria is most central to distinguishing a behavioral pattern of substance use disorder from physiological dependence alone? A, needing increasingly larger amounts to achieve the desired effect. B, continuing substance use despite significant substance-related problems. C, experiencing withdrawal symptoms when substance use is discontinued. Or D, experiencing strong cravings or urges to use the substance. So which one most clearly distinguishes behavior pattern, so a pattern of substance use, from physiological dependence? Okay, what you guys got? Okay, I see B. I see a lot of B's. All right. The correct answer is B. Continuing substance use despite significant substance-related problems. B is correct because continued use despite experiencing problems demonstrates a behavior pattern of problematic use, a characteristic of substance use disorder. A is incorrect because this describes tolerance, which can occur with physiological adaptation and does not by itself establish substance use disorder. C is incorrect because this answer describes withdrawal symptoms, another sign of physiological adaptation that can occur without substance use disorder. And D is incorrect because craving is a substance use criterion, but it does not distinguish substance use from a physiological dependence as strongly as continued use despite harmful consequences. So this kind of question, it may not seem tricky to some of us, but for some people it may kind of trick you up. This question is asking you to distinguish between physiological dependence, so needing it, depending on it, particularly tolerance and withdrawal, from the broader problematic behavior pattern associated with substance use disorder. So there will be behavior patterns, and then there will be criterion. So the skill that's being tested with a question like this is being able to tell the difference between physiological adaptation from behavior indicators of substance use disorder. So if you're a person that gets caught up on words, I'm a person that if I can read the word, I can pronounce the word, but if it's too many of those words together, I overthink it. So I re-ask the question to myself like a fifth grader. Like, first of all, what are they asking me? Because you may get a question that is very wordy, very long, and they only asking you something very simple, and you've overthought the question. So what is this question asking? And then secondly, I reword it to myself as simple, in the simplest form. Now, if you don't have problems with that, you're fine. But if you're a person that lets you get intimidated by some of the jargon, practice simplifying what they're asking you. Question 3. Most addictive substances affect different parts of the brain, but they share a common effect that helps reinforce continued substance use. Which brain process is most associated with reinforcing effects of addictive substances? A. Increase serotonin activity with brain regions responsible for mood regulation. Reduce GABA activity within brain regions responsible for coordination and movement. C. Increased norepinephrine activity with brain regions responsible for attention and alertness. Or D. Increased dopamine activity within the brain's reward pathway, including the nucleus accumbens. So, which of those processes is most associated with reinforcing effects of addictive substances? So, which of these processes explains what happens when somebody gets addictive, makes the addiction worse, or reinforces it? The correct answer is D. D is correct because different substances act on the brain in different ways, but a major feature of reinforcement, or a major feature what makes the addiction continue, is increased dopamine signaling in the brain's reward circuit, particularly the pathways involving the nucleus. This helps strengthen the connection between the substance and the desire to use it again. The brain, you feel great. You're not stressed. You don't feel these emotions. You're not worried about whatever you're worried about. And it's like a false sense of feeling good. But when you come down off the substance, now you have an issue because it's a fake dopamine hit. A is incorrect because serotonin is involved in mood, sleep, and other functions. And some substances can affect your serotonin, but it's not the primary shared reward mechanism. B is incorrect because GABA is an important inhibitory neurotransmitter and is affected by substances such as alcohol, but this is not the common reinforcement pathway across all drug classes. And C is incorrect because this affects alertness and arousal and the stress response, and it can be altered by some drugs and substances, particularly stimulants, but it's not the primary shared reward mechanism. So what they're saying is across the board for all the drugs, all of them share in common that they boost your dopamine. So what this question is asking you, if you get a question about pathways and neurotransmitters, they're asking you to understand the basic brain reward process that helps reinforce repeated substance use across different drug classes. So pretty much as addiction counselors, we need to understand why people do drugs and why it becomes addictive. The skill being tested is connecting basic addiction neurobiology with development and reinforcement of substance use behaviors. Question 4. A client initially uses a substance occasionally for enjoyment. Over time, the client begins using it regularly to manage stress. Despite experiencing missed work, financial problems, and difficulty completing daily responsibilities, the client continues using and reports feeling unable to function without the substance. Which progression best describes this pattern? A. Use, misuse, dependence, then addiction. B. Use, tolerance, dependence, then withdrawal. C. Experimentation, misuse, intoxication, then dependence. Or D. Misuse, dependence, use, then addiction. So for this particular scenario, which of these answers describe how this client progressed in their use pattern? Okay, let's see what you got going on. So the client first started using it just for enjoyment, then started using it to manage stress. Then it started to mess with work and it started to cause problems, but they kept using. And now they can't do anything without using. Okay, I see A, I see B, I see C, I see D. Okay. The correct answer is A. So the first part describes the client's just using. The second sentence or descriptive shows misuse. The misuse will go under managing stress with the substance. And then continuing to use. And then dependence is using even though they were having issues. And then the last part would describe addiction. So it progresses from recreational use to a problematic misuse to some signs of dependence, and then ultimately you see a characteristic of addiction. B is incorrect because tolerance and withdrawal may occur during repeated substance use, but neither is established by the information provided. C is incorrect because intoxication describes the effects of a substance after using it, but it is not a stage that necessarily follows misuse. And D is incorrect because the sequence is incorrect because substance use would not typically appear as a later stage following dependence. So typically, you wouldn't go straight to dependence. What is a question like this asking us? They want to see if we can recognize how substances can progress from use to problematic patterns to addiction. Because remember, as addiction professionals, we will see someone come in and they may use substances, but they do not meet criteria for a substance use disorder. Everyone does not meet criteria. So we need to be able to distinguish between the pattern of use so we can be able to support them correctly. The skill that's being tested is recognizing patterns of substance use and distinguishing between when a client is just using, when a client is misusing, when the client has become dependent on a drug, and when a client has a full addiction and can meet criteria for a substance use disorder. And remember, no matter how long we're in this field and no matter how many times we see something that's similar, we have to treat each case as you're starting from scratch, because you can have someone using a drug that is highly addictive, but from what they're reporting, they may not meet criteria. So, and also, you see circumstances where people may go on binges, but they never used before. That does not necessarily mean that they meet criteria for a substance use disorder. Now, can they still receive substance use counseling or treatment? Yes. But we then have to figure out what is the most appropriate intervention and level of care. Question 5. A client with a long-standing history of daily substance use reports the sudden onset of irritability, hyperactivity, and insomnia while traveling away from home for several days. The client notes that these exact symptoms have emerged during previous attempts to decrease their usage and are immediately alleviated when they resume their standard dosing regimen. Which finding most specifically indicates that the client is experiencing a withdrawal syndrome? A. The emergence of intense psychological urges and intrusive thoughts regarding the substance during the period of abstinence. B. The immediate cessation of physical and psychological distress upon the reintroduction of the substance at the typical dosage. C. The physiological requirement for increasingly larger quantities of the substance over time to achieve the desired psychoactive effect. Or D. The client's decision to continue regular use despite the reoccurrence of interpersonal conflicts and significant role impairment. Which one of these indicates that the client may be experiencing withdrawals or with a withdrawal syndrome? Very wordy, might I add. The correct answer is B. B is correct because the symptoms occur when regular substance use is interrupted. And then the client feels better after they start the substance again. This pattern strongly supports withdrawal associated with the physiological dependence. A is incorrect because this answer is more consistent with craving. C is incorrect because this answer leans more towards a buildup of tolerance. And D is incorrect because continued use despite having problems is an important substance use disorder criteria, but it does not specifically identify withdrawal. A question like this is asking you to be able to tell the difference between withdrawal from craving, tolerance, and other substance use symptoms when several substance-related features are present. So basically, they're saying we're taking our foundational knowledge, and if you have a client that presents with 2, 3, 4 symptoms, they want to know if, as an addiction professional, you're able to distinguish between these different symptoms and not just jump to a conclusion. You need to use clinical reasoning and the DSM-5 and what you know as an addiction professional to identify how to support them. So your knowledge of symptoms, hence our topic of symptomology, will come into play. So the skill that's being tested is recognizing withdrawal symptoms and telling the difference between closely related substance use symptoms. So again, you need to have foundational knowledge of tolerance, craving, all of the symptoms of someone using. And then you also need to have knowledge of use, misuse, and addiction. Then you also have to have knowledge of withdrawal syndrome or criteria for a client to meet substance use disorder. So Albert called this a layered question. So like a deeper clinical reasoning question where you take those easy questions. Sometimes some of you ask me, so why you use some of those easy questions? Because sometimes we be a little rusty. We get rusty on our foundational knowledge. And then when we get to those stack questions, if you are still confused about like withdrawal symptoms and substance use, the basic substance use symptoms, and you're not really strong in your substance use disorder, sometimes you might jump to the conclusion of diagnosing. You might get diagnosing questions incorrect then. I hope I'm being clear. So yes, you have to have the foundational knowledge, and then you take that foundational knowledge and you use it for more deeper clinical questions so you can show that you understand that every client is not going to meet criteria. They may be having symptoms, but they may not meet criteria. All right, question 6. A client presents for an evaluation. They report using prescribed benzos for anxiety, but occasionally take additional pills when feeling overwhelmed. The client continues to maintain employment and family relationships without impairment. They deny needing increasing amounts to achieve the same effect and report no withdrawal symptoms when use is reduced. How would this pattern of substance use be most accurately classified based on the information? A. Substance use disorder, moderate. B. Substance misuse. C. Substance use disorder, mild. Or D. Physiological dependence. So you're doing an eval or an assessment. They say they're using benzodiazepines for anxiety. So they're prescribed. They add extra pills when they feel overwhelmed. The client, they're doing all the things. No interruption in functioning. No report of tolerance, increase, or withdrawal symptoms. Which one is the correct answer? Let's see what you got in the chat. I see B. Okay, I see lots of B's. The correct answer is B. Substance misuse. B is correct because taking prescription medication in a way other than prescribed is misuse. Based on the information provided, they do not meet criteria for a substance use disorder. A is incorrect because moderate substance use disorder requires that the client have 4 to 5 DSM criteria. We do not see this in this scenario. C is incorrect because mild substance use disorder requires a client to meet 2 to 3 criteria. And misusing medication does not fit that description. They do not meet criteria. And D is incorrect because dependence would typically involve tolerance or withdrawal. So neither of which is reported here. Now, this could be problematic, or the client might benefit from prevention or therapy, but they do not meet criteria for substance use disorder. So this question is asking you to be able to tell the difference between substance misuse and a client meeting criteria for a substance use disorder. And you also need knowledge of withdrawal, tolerance, and physiological dependence. So the symptomology, you need to understand symptoms of addiction. So the skill that's being tested and the skill you need to be familiar with is assessing and evaluating patterns of substance use and avoiding over-identifying someone as having a substance use disorder. So this could kind of tie into why we even get certifications and licensing anyway, because we are a specialty. So we want to show that we have done the additional training and skills work to be able to identify this, because someone outside of the field may automatically think someone has a substance use disorder. And they would, because they haven't had the training we had. So again, this is the type of question that may be asked, so we can show this is how we distinguish ourselves from someone who does not have the knowledge and the skill to diagnose and to support clients with substance use disorders from professionals working in the specialty. Question 7. A 28-year-old client arrives at an outpatient clinic appearing disoriented with slurred speech and difficulty maintaining balance. The client reports consuming a large amount of alcohol approximately 1 hour ago and has difficulty following directions. Which intervention should the counselor prioritize first? A. Refer the client for inpatient withdrawal management. B. Complete an assessment of the client's alcohol use. C. Monitor the client and address immediate physical safety. Or D. Administer a screening tool for alcohol-related problems. Which one should you do first? Questions asking you what you should do first typically is trying to see if you can keep the client safe. So which one would you choose to ensure safety first? Okay, I see B. I see D, unless that's from a previous question. Okay, I see C's. Okay. The correct answer is C. Monitor the client and address immediate physical safety. C is correct because the client is showing signs of acute alcohol intoxication, including slurred speech, disorientation, and impaired balance. The immediate priority is safety and stabilization before proceeding with any routine screening or assessment. A is incorrect because withdrawal management may be appropriate based on further assessment, but the client is currently showing signs of intoxication, not withdrawal. B is incorrect because you need an assessment, but an intoxicated client may not be able to provide accurate or reliable information. And D is incorrect because a screening can occur once the client is stable and able to participate appropriately. So again, another great way to break down your questions is if you're being asked a scenario question, immediately ask yourself, 1, in plain language, what are they asking me? 2, what part of the counseling process is this? Am I in the beginning, middle, or end? Because context is going to be very important, and that'll help you be able to get to the correct answer quickly. And then lastly, what is the safest answer based on the context of the question? So this question already shows you're at the beginning. You're at the beginning of the counseling process because they're coming in. They just arrived. And then they give you the symptoms. So in this context, everything is after safety. A question like this is asking you to recognize intoxication symptoms and your ability to determine what to do immediately, how you prioritize, how you help the client. And the skill being tested is recognizing acute intoxication and being able to prioritize care. So what comes first? Question 8. A client receiving substance use counseling reports drinking wine approximately twice a month. The client describes significant conflict at work and reports exercising for 3 to 4 hours daily to avoid thinking about the situation. When unable to exercise, the client experiences intense restlessness and racing thoughts. No increased substance use or substance-related cravings are reported. What is the best next step for the substance use counselor? A. Explore whether the exercise pattern represents a substitute for substance use. B. Develop coping strategies to reduce the client's reliance on excessive exercise. C. Continue substance use counseling while monitoring the exercise-related symptoms. Or D. Assess current substance use and refer for evaluation of the non-substance concerns. So which is the best next step? Client drinks wine twice a month, has stressors like work, and they have been exercising for 3 to 4 hours. You see how there was like a Freudian slip, guys? I said she. We don't even know if it's a she. See, that's that implicit, that bias hopping out. My apologies. I literally said she, and it does not. See? Okay, what would you do as the counselor? The correct answer is D. Assess current substance use and refer for evaluation of non substance concerns. D is correct because the counselor should assess whether there are current substance related needs within their scope. Also, recognizing that the significant compulsive behavior, restlessness, and racing thoughts may require further evaluation by an appropriate mental health professional. A is incorrect because the counselor can explore the relationship between behaviors, but should not assume that excessive exercise is functioning as a substitute for addiction. B is incorrect because coping strategies may eventually be appropriate, but treating the underlying non substance use symptoms may extend beyond what you can do as a counselor. And C is incorrect because monitoring alone may delay appropriate assessment of symptoms that are not primarily related to substance use. So, what is a question like this asking you? They want to see if you can recognize when a client's presenting concern extends beyond your scope. So, this is an assessment screening question. This is also an ethics question. This is also a referral question. This is a layered question. So, maybe like four of the four core functions. And the skill that's being tested is maintaining your scope of practice, assessing substance related needs, and making appropriate referrals when other clinical concerns emerge. So, as addiction counselor professionals, they are testing whether we can, again, appropriately support the client. So, sometimes you may have clients come in that have used drinking or substances as a coping skill, or whether it's unhealthy or you know but that may be not the full picture. And if you, after screening or assessing, find that the chicken came before the egg, meaning there's other underlying issues and the substance use is not a safety concern, they do not meet criteria for substance use, then we need to refer out so they can get the support they need. And you may see this often because sometimes addictions, they'll come in pairs or triplets. So we'll see substance use with gambling, substance use with eating disorders, substance use with exercise behavior, substance use with body dysmorphia. And as a professional screening and assessment, you need to figure out, okay, is this client going to continue to work with me? Because sometimes you may have to work with the client for a substance use issue and also refer out because it's co-occurring. Question 9. A client with a history of substance use disorder passes a neighborhood where they frequently used substances in the past. Without planning to use, the client suddenly notices a faster heartbeat, increased anxiety, and a strong urge to use. Which concept best explains the client's response? A. The client is consciously considering the benefits and consequences of returning to substance use. B. The client is automatically reacting to a cue previously connected with their substance use. C. The client is experiencing physical changes caused by the brain adapting to repeated substance use. Or D. The client is redirecting uncomfortable feelings about substance use towards other people. Which answer explains what's happening with the client. They have a history. I'm assuming they're in recovery. They pass a neighborhood and they start to have all these physical symptoms, racing heartbeat, anxiety, and then they want to use. Okay, so during, it depends on your particular exam. I use multiple choice, sometimes scenarios, sometimes just regular fact multiple choice. So I don't know exactly how your exam would be structured. I know the ICNRC website has like a PDF for both the AADC and the ADC, and they do a great job of explaining how your questions are structured. So with my questions, I think you should focus more on the topic and mastering the concept. But for a specific answer on how your questions will be structured, go to your exam website. All right, I see lots of B's. The correct answer is B. The client is automatically reacting to a cue previously connected with their substance use. B is correct because cue reactivity is an automatic response that can happen when a person encounters something previously associated with their use. People, places, smells, objects, emotions, or situations can serve as a cue and trigger physical reactions and cravings. A is incorrect because this answer describes conscious decision making. Cue reactivity can occur automatically. C is incorrect because this answer is more closer to physiological changes associated with repeated substance exposure. So it leans more to when the client uses rather than a automatic physical response. And D is incorrect because this describes psychological defense processes and does not explain physical and craving response to a substance related cue. What is this test? What is this question asking? They're asking if you, as the addiction professional, can recognize how people, places, things, situations, emotions associated with past substance use can trigger an automatic response and craving. So, knowledge of this really helps with recovery planning, relapse prevention planning, and also psychoeducation. So, that's one of the 12 core functions. So, as addiction professionals, we have to educate clients, the public, other clinicians, because if you don't work in this field, you might not have a well rounded idea or knowledge of how strong addiction can be, how strong drugs can be. And I think sometimes when we work with clients, if they're not prepared for these type of physical and psychological responses, it can really cause a sudden relapse because they're not prepared. So we have to know about these type of responses, cues and triggers and stuff like that. The skill that's being tested is recognizing substance use triggers and cue related responses that may increase the client's relapse risk. Question 10. A client reports that substance use has become part of the routine over the past year. The client continues to meet work responsibilities and denies significant relationship problems. However, they frequently spend more time using than planned, have repeatedly tried to limit their use without success, and have stopped participating in several activities they previously enjoyed. The client does not believe their substance use is a problem. Which finding most strongly supports the presence of a substance use disorder, despite the client's perception that they are functioning well? A, the client continues to maintain major responsibilities despite regular substance use. B, the client does not personally believe the current pattern of use is problematic. C, the client's substance use has become incorporated into their regular daily routine. Or D, the client demonstrates impaired control and reduced involvement in value activities. So, which one of these answers best supports that the client is not functioning well and they may have a substance use disorder, even though they're doing all the things, but they're just using more. Okay, the correct answer is D. The client demonstrates impaired control and reduced involvement in value activities. D is correct because in this scenario, they give you important substance use disorder symptoms. The client uses longer than intended, has unsuccessful attempts to control their use, and has given up important activities. These indicate impaired control and social functioning impact, even though the client remains employed and does not identify the use as problematic. A is incorrect because maintaining employment does not mean that the person does not meet criteria for substance use disorder. They don't have to experience negative effects in every part of their life. B is incorrect because a client's perception is important, but it's not abnormal for clients to not see their use as a problem, because remember, that's why it's an addiction. It is serving a purpose. So if something is making me feel good and helping me with my stress management, I don't want to see it as a problem. So just because they don't recognize it doesn't mean they don't have a problem. And C is incorrect because regular or routine substance use alone does not establish a disorder. We as the addiction professional must look at the broader pattern. So again, you may have clients show up, or you may have questions on your exam that says the client shows up and reports they've used cocaine twice in the last month. As addiction professional, the trained, skilled, knowledgeable professionals we are, we don't automatically say, oh yeah, you have a problem. Cocaine use disorder, stimulant use disorder. We have to then assess and look at all the patterns and then see if they meet criteria. What is this question asking? Can you recognize substance use disorder symptoms? Especially when the client appears functional. And the skill that's being tested is your ability to identify impaired control and functional changes within complex client presentations. So these type of questions are testing your ability to look at the whole person and the person as their own individual person-centered care. Because again, you will have clients that come in that are quote unquote high functioning, or they appear to have no issues with their daily functioning. They're going to work, they're taking care of what they need to take care of. They haven't hurt themselves, they appear happy, all of the things. However, as the addiction professional, you do a screening, you do an assessment, and you get the whole picture so you can be able to establish how to best support them. All right, that was hour one. I'm going to give it about 60 seconds. I'm going to stretch. Did that go by fast? That hour went by fast, guys. If you're watching the playback, put in the comments what question was most difficult for you, or what question gave you the most insight. under the symptomology section. Okay. In about 60 seconds, I'll start hour 2. Hour 2 is on pharmacology basics. Okay, you got water, you stretched. If you're just joining us for hour 2, welcome. Hello to the playback. If you're with us, you're sitting, rewatching. Hello. Have your pen and your paper out. That way the idea is for you to take notes when I start to explain incorrect and correct answers, so you better reinforce what you learned. All right, before we get started, please put a 1 in the chat if you can still hear me clearly. No lagging, no issues. I went in, I turned off the automatic monetization. I went in, I'm learning how to work YouTube Studio, so basically that makes me like some type of engineer, right? Because I now can work YouTube Studio. I can now push a button and select to turn off the if you were here last week, the monetization, all the ads were turned on and it was making the live lag. So I had to manually go in and pause it. But now that I am a YouTube connoisseur and a YouTube professional, I know how to go in and turn all of that off so we can just study straight through. So I do appreciate y'all patience from last week. All right, thank you for the ones. Let's go ahead and get started, y'all. Pharmacology basics. You are expected to understand how different substances affect our brain and body. So this will include major drug classes, so understanding what stimulants are, what depressants are, what drugs, opiates are, cannabis, and hallucinogens, and know the general effects associated with each. So understanding how these drugs and these different drug classes affect our mind, our body. You need to understand neurotransmitters like dopamine and the brain's reward system. So you'll hear me going back to this over and over again because we're not studying to be pharmacists, but we do need to understand pharmacology basics so we can understand how our clients present. And then lastly, we need to be familiar with medications used in substance use treatment. So what are just like maybe the top 5 or 10 what medications show up mostly often when we're talking about opioids, when we're talking about MAT, medication assisted treatment, how medications interact with each other, what medications can put the clients at risk. So again, pharmacology basics. When we're taking our exams, we need to pay attention to symptoms. So if you're doing a scenario and they're talking about medications, pay attention to the symptoms, their physical symptoms or psychological symptoms that they are providing you, and that should give you a clue as to what drug they're talking about or what drug class. All right, the skills you need to know under pharmacology basics. You need to be able to take what you know and apply it to whatever the question is asking you to do. So if they're asking you to identify your next steps to keep the client safe, they may ask you to recognize what drug class it's in. They may describe an effect, and you need to be able to identify the drug. You should also be able to look at the client's symptoms and determine what type of substance they may be involved in or may have taken, so you can understand what risk they're at. And then we also need to understand our role as addiction professionals. So, as addiction counselors, we need to understand the next steps to assess further, monitor the client, make a referral, or respond to immediate safety concerns. Question 1. Nearly all substances of abuse reinforce continued use by increasing activity of which neurotransmitter within the brain's reward pathway, particularly the nucleus accumbens? A. Serotonin. B. GABA. C. Dopamine. D. Glutamate. So all substances or all drugs become addictive, and the person keeps using them because of activity in which of the brain's pathway, which area of the brain, or which neurotransmitter within the brain's reward pathway. So what causes it? And I think I asked this question in another way in the first hour. Let's see what you guys are saying. See a couple C's. The correct answer is C, dopamine. C is correct. Dopamine plays a major role in the brain's reward and reinforcement system. Addictive substances can increase dopamine signaling in the reward pathways, including the nucleus accumbens, which helps reinforce substance taking behavior. A is incorrect because serotonin is strongly associated with mood, sleep, and appetite and other functions. B is incorrect because GABA is the brain's major neurotransmitter and it's particularly important in understanding depressant substances. So remember, our question asks about all substances of abuse. So basically, what do all these substances have in common in terms of the area of the brain that it affects? Indeed, glutamate is the major neurotransmitter and plays an important role in learning, memory, and neural adaptation. So, drugs and substances of abuse affect all of these neurotransmitters. However, only one area is affected by all substances of abuse. So, you see how these type of questions are not clear cut, but they're very nuanced. What is a question like this asking? Do you know about neurotransmitters associated with reward and reinforcement in addiction? So you need to understand serotonin, GABA, dopamine, and glutamate. And you need to understand the brain's reward pathway. So figure out a way to remember why substances are so addictive. What does it do to our brain? And you're going to be hitting maybe 5 to 10 different study areas. The skill that's being tested, your ability to connect neurobiology basics, pharmacology basics, and neurotransmitter functions to substance use and addiction. Question 2. A client who regularly uses benzos reports a significantly reduced response to alcohol, even though they rarely drink. This physiological adaptation is best described as synergism, cross tolerance, potentiation, or antagonism. So the client is using a benzodiazepine, went out for a drink, and noticed that maybe they had a couple drinks. They don't say, but the response to alcohol is reduced. So they notice that the alcohol is not affecting them, even though they rarely drink. So they should be feeling the effects of alcohol pretty easily. Which one of these is it is describing the physical effect? The answer is B, cross tolerance. This occurs when tolerance to one substance results in reduced response to another substance with similar effects. So benzo and alcohols are both depressants and have overlapping effects involving the GABA system. And if you've been here, we always have a question about risk and using substances together. And immediately when you hear benzodiazepines with alcohol, that is a no, because it slows down your breathing. It slows down your central nervous system. So if you see anything with benzos and alcohol, immediately look for either the effect, that is a no, that is a safety issue. So you already know you're looking to keep the client safe. So no matter how you're asked about benzodiazepines and alcohol, you already know to be on alert for safety, because those two are a no. Increases the risk. A is incorrect because synergism occurs when substances taken together produce a combined effect greater than expected from either substance alone. So synergism is like two characters in a movie coming together and winning the championship or winning whatever the grand prize is, and it was not expected. So that's what happens when two drugs are taken together and the effect is greater than how they would be on their own. Potentiation occurs when one substance increases or enhances the effect of another. And an antagonism occurs when one substance reduces or blocks the effects of another. If you saw our live on opiate use disorder, antagonist medications and antagonism should pop out to you, because certain medications that are treated for opioid use disorder, some of them are antagonists and some of them are antagonists. So some drugs block the effects of other drugs, typically in MAT, medication assisted treatment. So that should stand out to you. What is this type of question asking? They want to know, can you recognize the difference between cross tolerance and other types of drug interactions? So if you have your pencil and paper and you have your category as pharmacology basics, you should understand drug interactions. You can make your own checklist. If you don't want to make your own checklist, I have a checklist. It's about 67 pages on the Stand Store, but you can make your own checklist. The skill that's being tested, Your ability to identify pharmacological relationships between substances and applying them to client scenarios. So even though we are not a pharmacist, we are not a prescriber, we interact with clients who may take several different substances, and we need to understand what risk they're in, because they may report to us that they're taking 1, 2, 3 or more substances, and that should immediately put us on standby to understand how to support them. Do we need to immediately refer them? Do we need to immediately call for medical support? Question 3. Which of the following physical signs is most characteristic of acute stimulant intoxication, such as cocaine or methamphetamine use? A. Pinpoint pupils and respiratory depression. B. Red eyes and increased appetite. C. Dilated pupils and tachycardia, which is increased heart rate. And D, slurred speech and impaired coordination. So which one describes physical signs of acute stimulant intoxication? Okay. Can everyone hear me? Put a 1 in the chat if you hear me clear. Let me know if you can hear me clear, Doreen. Am I back? Am I lagging? I see some C's in the chat. Are you guys able to hear me? And you know what, guys? I'm waiting to see if everybody can hear me clear. It may be some of the language. Now, we usually don't have any issues with our subject topics that we're talking about because it's an educational channel. But I did see somewhere, like, if you say certain words, they will slow down your live or interrupt your live. So it may be every time I say like a controversial word. Well, we talk about drugs. Okay. Doreen, it may be your either you're on Wi-Fi or where you're at, because I'm getting some ones in the chat so they can hear me. All right. The correct answer is C, dilated pupils and tachycardia. So they may have lagged it because of the M word. We just studying over here, YouTube. We just studying. We have to say these. We have to use the language. I'm not a big fan of changing our language. We're learning over here. I think it's because I said the M word, y'all. I totally forgot that when you're on live, if you say something that they deem as like a trigger word or a word that you may be talking about something inappropriate, they will pause your live or lag it. C is correct because stimulants increase activity in the central nervous system. So it increases things, increases your heart rate, make your pupils dilate. Elevated blood pressure, increase alertness. It may even increase agitation and restlessness. A is incorrect because pinpoint pupils and respiratory depression, that leans more towards opiate intoxication. B is incorrect because red eyes and increased appetite are more commonly associated with cannabis intoxication or marijuana intoxication. And D is incorrect because slurred speech and impaired coordination are more characteristics of central nervous system depressant intoxication, including alcohol. A question like this, what is it asking? It wants to know if you can recognize substance use is based by class and the physical presentation or the physical symptoms of intoxication for each. The skill that's being tested, your ability to identify signs of stimulant intoxication and being able to distinguish between Stimulant intoxication, depressant intoxication, opioids, cannabis, and drugs. So having knowledge of how different drugs affect us physically when we're intoxicated. Okay, question 4. Which medication used in the treatment of opioid use disorder acts as a long-acting full opioid agonist that helps prevent withdrawal and reduce cravings when taken as prescribed? A. Narcan. B. Suboxone. C. Vivitrol. Or D. Methadone. If you can't immediately recognize each of these medications, write them down and figure out how to remember them. All 4 are often used in opioid use disorder and in MAT, medication assisted treatment. So which one used in treatment of opioid disorder is a long-acting full agonist? Let's see. Okay, I see some D's. I think we're rocking and rolling, you guys. The correct answer is D, methadone. Methadone is a long-acting full opioid agonist. When appropriately prescribed and dosed for opioid use disorder, it can prevent withdrawal, reduce cravings, and help stabilize the individual without producing the rapid euphoria or the rapid happy effect associated with short-acting opioids. A is incorrect because naloxone is an antagonist and it reverses the effects of opioid overdose. So if you have your pen or paper, write down agonist versus antagonist and understand the difference between the two and how it is used in opioid use disorder treatment. Suboxone is a partial agonist used to reduce withdrawal symptoms and cravings. Suboxone combines both Suboxone and naloxone. So if you have your pen and paper under your pharmacology basics, understand what Narcan does, what Suboxone does, what methadone does. And C is incorrect because naltrexone is a opioid antagonist. It blocks the opioid effects and can be used for relapse prevention after opioid withdrawal. What is this question asking? Can you tell the difference between medications used in opioid use disorder? And do you understand how these medications work? So, what does a full agonist do? How does it work? What does a partial agonist do? And what does an antagonist do? Like, what's the difference between those three? How are they used? So, one blocks the effects, one reverses the effects. What skill is being tested? So, you need to be able to match opioid use disorder medications with their basic clinical purpose. Question 5. A client experiencing alcohol withdrawal reports a crawling sensation on their skin, formication, severe confusion, and significant autonomic hyperactivity. Autonomic. I don't know why that didn't roll off my tongue right. What is the most appropriate next step? A. Continue treatment through a standard outpatient counseling session. B. Monitor the symptoms for 24 hours for signs of improvement. C. Refer immediately for emergency medical evaluation for suspected delirium tremens. Or D. Encourage participation in peer support services for additional stabilization. So a client shows up with physical symptoms. They're saying crawling sensations on their skin. They present as confused, severe confusion, and autonomic hyperactivity. What do you do next? Okay, I see the C's. The correct answer is C. Refer immediately for emergency medical evaluation for suspected delirium tremors or the tremors or shakes. C is correct because severe confusion and autonomic hyperactivity during alcohol withdrawal are medical red flags. It is a medical emergency. So these tremors associated with alcohol withdrawal can be potentially life-threatening. Immediate medical evaluation is needed. A is incorrect because routine outpatient counseling is not appropriate. Remember, safety first. B is incorrect because waiting to see whether severe symptoms resolve could place the client at significant risk. And D is incorrect because peer support may be helpful later. But in this scenario, safety first, you want to address the medical needs of the client first because they are at high risk due to these symptoms. What is this question asking you? Can you recognize high-risk alcohol withdrawal symptoms? And do you know what to do in a situation when the situation has moved beyond routine addiction counseling? The skill being tested is your ability to recognize potential and medical emergencies and being able to make an immediate referral to the appropriate level of care. Question 6. A counselor is reviewing how a substance moves through the body after it's taken. The counselor explains that the substance enters the bloodstream, travels to different tissues, is broken down by the body, and is eventually eliminated. Which pharmacological concept best describes this process? Pharmacodynamics, pharmacokinetics, bioavailability, or drug metabolism. So which answer describes the process of how the drug enters the bloodstream, travels to different tissues, is broken down in the body, and eventually eliminated? What is that process called? The correct answer is B, pharmacokinetics. B is correct because this describes what the body does to a drug, including absorption, distribution, metabolism, and excretion. ADME. So, how it travels through the body. Pharmacokinetics. A is incorrect because pharmacodynamics focuses on what the drug does to the body, including the effects and mechanisms of action. C is incorrect because bioavailability refers to how much of a substance reaches the bloodstream and is available to produce a certain effect. And D is incorrect because drug metabolism refers specifically to how the body breaks down a substance and is only one part of pharmacokinetics. What is this question asking? Do you understand the difference between basic pharmacology concepts? Like how a drug affects the body, how it moves through the body, how it affects the drug stream, how it's perception, mood, and sensory experiences. A, serotonin. B, norepinephrine. C, let me say this right, acetylcholine. Or D, GABA. Acetylcholine. I pronounced it correct. So, which neurotransmitter system is related to hallucinogen effects? Oh, I see A's. Oh, shortly unless you restart your system. Oh, okay. Put a 1 in the chat if you can hear me clearly. All right, says it's moving slower than usual. I see your A's. All right. I'll wait to move forward to make sure you guys can hear me clearly. Great. I see your 1, Letitia. I see your 1, Della. Thank you. The correct answer is serotonin. Classical hallucinogens such as LSD produce their effects through the serotonin system, particularly activity at 5-HT2A serotonin receptors. This contributes to altered perception, sensory experiences, mood, and thinking. Norepinephrine is strongly involved in alertness, arousal, attention, and the body's stress response. Acetylcholine plays important roles in learning, memory, attention, and muscle activity. And GABA is particularly important in understanding central nervous system depressants such as alcohol and benzodiazepines. What is this question asking? Do you understand neurotransmitters in the neurotransmitter system? And do you understand that it's most closely associated with the effects of hallucinogens? The skill connecting major drug classes with the neurotransmitter systems. So, which system connects to particular drugs? Okay, let me check the chat before I get to. Okay. Question 8. A client experiencing a severe opioid overdose presents with dangerously slowed breathing and is minimally responsive. Which complication requires the most immediate attention, and which medication is used for rapid opioid overdose reversal? A. Cardiovascular instability and methadone. B. Respiratory depression and naloxone. C. Seizure activity and diazepam. I think my thing is lagging. Or or D. The hepatic impairment and buprenorphine. C. The correct answer is B. So even if I think A and B would probably be the two answers that will probably trip me up. But as soon as it said something about opioid reversal, we know naloxone is used for reversal. B is correct because opioids can significantly suppress the brain's drive to breathe, resulting in respiratory depression. And naloxone, which is the medication for the name brand, is Narcan. So Narcan is the brand, but naloxone is the medication. Is an opioid antagonist used to rapidly reverse opioid effects during a suspected overdose. A is incorrect because methadone is used in treatment of opioid use disorder, but it does not reverse overdose. Diazepam may be used for certain seizure-related conditions, but it does not reverse opioid-induced respiratory depression. And buprenorphine is used to treat opioid use disorder, and it's not the standard medication for emergency overdose. So Narcan or naloxone, name brand, the particular brand is Narcan that is most, I would say, is most popular. Will reverse opioid overdose. What is this question asking? Can you recognize the primary immediate dangers of opioid overdose? And can you identify the appropriate reversal medication? In the skill being used, your ability to recognize opioid overdose symptoms and your ability to identify appropriate emergency response. So would you know what to do in the event that a client was showing signs of opioid overdose? Question 9. A client reports taking prescribed benzos and drinking several alcoholic beverages during the same evening. The client becomes significantly more sedated and impaired than would typically be expected from either substance alone. Which pharmacological concept best explains this response? A cross tolerance between two substances that produce similar central nervous system effects. B. Antagonism caused by one substance reducing the effects of another substance. C. Synergism caused by the substances enhancing each other's depressant effects. Or D. Potentiation caused by an inactive substance increasing the effects of an active drug. So the client is taking a prescribed medication, benzodiazepines, and is drinking. Okay, so that's the red flag right there. becomes sedated and impaired. What concept is being described? This scenario is describing synergism caused by substances enhancing each other's depressant effects. C is correct because this process occurs when two substances used together produce an effect that's greater than it would be on their own. Alcohol and benzos are both central nervous system depressants, so combining them can increase sedation, impairment, and respiratory risk. A, cross tolerance means tolerance to one substance produces a reduced response in another. B, antagonism occurs when one substance reduces or blocks the effect of another. That wasn't described in this question. And D, potentiation is closely related, but traditionally refers to one substance enhancing the effect of another. So if you have your notebook, I think we wrote this down before, so now we'll reinforce it again. So understand what cross tolerance is, what antagonism is, what synergism is, and what potentiation is. Question 10. During an intake, a client reports daily use of both stimulants and depressants, explaining that one substance helps balance out the effects of the other. The client does not currently report wanting to change either pattern of use. Following a safety first approach, what should the counselor prioritize? A, explore emotional factors contributing to the client's pattern of use of multiple substances. B, assess immediate medical and overdose risk associated with the client's polysubstance use. C, evaluate how the client's substance use is affecting current occupational and personal functioning. Or D, determine whether the client would benefit from additional substance use treatment and support services. I think I mentioned before, when you're looking at your questions, first simplify or be clear on what you're being asked in the question. So we're being asked, what should the counselor prioritize? So what should the counselor do first? Put first. What is most important? Secondly, in what context are we deciding? What part of the counseling process are we in? Are we in the beginning, the middle, the end? Are they telling us what type of service the client is getting? No, but they do say during intake. So we're at the beginning of the addiction counseling process. And what important details are we being given? Well, we know they're taking both stimulants and depressants, and they do not want to stop taking both stimulant and depressants. So what should we do first? Let's see what you guys say. Okay, I see B's. The correct answer is B. Assess immediate medical and overdose risk associated with the client's polysubstance use. B is correct because using both stimulants and depressants together can create unpredictable and potentially dangerous effects. One substance does not safely cancel out the other. Before addressing longer-term treatment needs, the counselor should determine whether there are immediate medical or overdose risks associated with the client's current pattern. A is incorrect because this would not address immediate safety concerns. So it's important. We do need to explore emotional factors contributing to use, But in this moment, we're in the beginning, we're in the intake. We need to put safety first so we can make sure the client is safe so they can continue treatment. C is incorrect because assessing functioning is an important part of the assessment and the counseling process, but it will come after the client has been deemed safe and we've addressed any urgent medical needs. And D is incorrect because treatment needs and referrals should be considered, but after safety, we need to determine whether the client's use requires more immediate response. What is this question asking? When several appropriate clinical actions are available, can you decide what happens first? Do you have the knowledge and the skill to effectively, safely, and appropriately support the client with what is done first to ensure their safety? And the skill that's being tested, your ability as an addiction professional to recognize risk associated with polysubstance use and prioritizing immediate safety during the assessment. So this means under this second hour, we reviewed basic pharmacology. You would use all of your pharmacology knowledge for a scenario question like this, because not only do you need to understand the names of the drugs or the drug class, you need to understand how these drugs affect our body and also how they affect our functioning when they're taken together. And then when you go, oh, they're using both stimulants and depressants, this places this client at high risk. Then you need to know how to make a decision to put safety first. And then you also need to know how to then move forward in terms of level of care, what referrals you make. Okay. So we're a little bit ahead of time. We're going to stretch. Take a sip of water. If you're just joining us for hour 3, welcome, welcome. Hello to the playback. If you're just joining us on hour 3, hello. Today we reviewed symptomology or symptoms of addiction, substance use, misuse in hour 1. And then we just completed hour 2 where we reviewed what did we review? My mind is going blank. Basic pharmacology. So we talked about drug classes, how drugs affect our body, a few of the medications that we should know, some opioid use disorder topics. And now we're moving on to substance use diagnosis. Thank you, Doreen. I appreciate you. Let me take a stretch and a gulp of water, and we are going to finish strong, you guys. We're in our last hour. while we have a few minutes, if you're still with us, put in the chat what topics and areas are the most challenging for you. This will help me figure out my next recorded videos. Which topics and subtopics are the most challenging, or the areas you need to do a little bit more studying in? No problem, Doreen. I enjoy it because I'm a lifelong learner, but I am not going back to school. I cannot afford I can't afford to go back to school. So this is like school. I love studying. So this kind of gets that out the way. Scratches that itch. I love PowerPoints. I love making worksheets. So this gets the teacher out of me, even though I'm your study partner. Okay, Doreen says assessment. So if you guys looked at the assessment video under the 12 core functions, I go over like the purpose of an assessment, the parts of a biopsychosocial assessment. I review my template that I use, certain questions that can elicit better answers from clients. Okay. So because I've already done the core function series, now my newer videos that I'm starting to record are subtopics and they're shorter. So now I'm going back and I'm just breaking down the general topics, and I'm gonna do a 5-minute or less series. So like the general overall topic can be like an hour-long video, which is great because we need to master the overall general topics. But now I'm going back and we're gonna do subtopics. So like under assessments, we can have 5, 10, 15, 5-minute videos from just that one topic because assessment is so broad. So that's what I'm up to now. Delilah says treatment, counseling, and referral. Okay. And Delilah says TAP 21. So yes, Delilah asked me the other day, and thank you, Delilah. She gave me a video idea. She asked about TAP 21, and those are like quote unquote core functions, but from a SAMHSA skill perspective. So they'll overlap a little bit, but that would be a great series. So TAP 21 is just like professional standards and skills per SAMHSA. So you'll see some familiar concepts too. As a matter of fact, we got about a couple more minutes, then we're gonna start hour 3. I'm gonna go over here and get my I have my TAP 21 printout right here with me. So TAP 21 are addiction counseling competencies, the knowledge, skills, and attitudes of professional practice. And if you go to samhsa.gov, or if you Google SAMHSA TAP 21, it will take you to the link, and it's a public evidence-based research PDF, and download it. So I base my questions off government websites, evidence-based websites, or the exam websites. So sometimes people ask me, where are you getting all this stuff from the exam website? So NADAC has free PDF downloads. ICNRC has free downloads. So I'm not making up questions in terms of the topic. I'm just making up how I present them. But everything is based in what we do in our profession, our professional standards. So yes, I'll be using the top 21 outline to do some videos, and then I'll also be going back doing shorter videos for those of you who just like subtopics, bite-sized subtopics. All right, Joanne says pharmacology, which can be kind of overwhelming. That was overwhelming for me. If you watched my I passed my addiction counselor exam on the first try. Pharmacology was my challenging area because while I worked in community health and I worked almost exclusively with clients who were affected by substance use, I more so dealt with like environmental factors, direct support factors. So I would know that they have a substance use disorder, they struggle with a particular drug, but I more so supported them with connecting them to help back then. But I didn't know their medication, like their medications were listed, but I just didn't have an extensive knowledge like someone would have who works in like a MAC clinic or an opiate treatment clinic. So I really had to study. And even now, some words that I see in terms of medication, you will see me pause so I can pronounce it correctly. Because again, most of us are clinicians. Some of the tasks we do daily, we only do it per our work or our organizations or what population we work with. So if you don't work in a substance use clinic, you're not gonna stumble upon a lot of these medications. So again, like I said, I'm still learning too. Jamie says ethical and physiological. Taking NADAC soon. Jamie, you taking? Oh yeah, you said NCAC too. So ethical boundaries. Okay, yeah. So ethics. Okay. Okay, Delilah. So yeah, so you work in medical detox. So you know more about the medications and than I would. So I do more community health, and then I also do DUI assessments. So assessment is my strong point. Medication and different medications is my area that I continue to work on. Okay, so I see ethics comes up a lot. I would say the number one request is ethics, pharmacology, and counseling skills. Those are the top three that requests I get. All right, so it is hour 3. We have made it to hour 3, you guys. It goes by so fast. So, hour 3 of our 3-hour intensive will focus on substance use diagnosis. And for substance use diagnosis topics, we need to be familiar with DSM-5, DSM-5 TR criteria. There are 11 criteria. And we need to be able to look at symptoms that occur within a 12-month period and form a pattern of problematic substance use. We need to be able to make sense of the information that we're given. So diagnosing is using the criteria to diagnose a person with a substance use disorder. Once we are able to identify the criteria, we need to be able to determine how severe it is. So 2 to 3 symptoms is mild, 4 to 5 symptoms is moderate, 6 or more is severe. And we also need to be able to identify which substance is involved. Because we diagnose the disorder based on the substance class, we need to understand effects of alcohol, opioid stimulants, and cannabis and other substances. And then we also need to be able to tell the difference between a substance use disorder, intoxication with related, but they're not the same, and they won't warrant the same diagnosis. Okay? So the skills related to this topic of substance use diagnosing, we need to be able to take the information and determine whether the client actually meets criteria. So we need to be able to pay attention to the symptoms, the pattern of use, and whether those symptoms occurred within the required time frame. We also need to understand the symptoms that are reported to us. Do they fall under mild, moderate, or severe based on the number of criteria present? We also need to be able to select the most accurate diagnosis by identifying the substance involved, the disorder, and the appropriate severity. Is anyone following the Clancy trial? That's hitting really close to home in terms of medical care, mental health care, documentation. So if you're not aware of that trial, I think it's Lindsay Clancy. And you can look it up and you can get the gist of why she's on trial, why the psychiatric providers were subpoenaed to testify, and why the medical and mental health staff, all notes are being reviewed. It's evidence. So again, to bring it back home to how that relates to what we're doing, one, it kind of reinforces the purpose of licensing and certification. So we absolutely do need training, and we do need to be tested on it so we can show that we understand this. But also the skill part. The skill part is very important. Okay, let me look at the chat before we go to question 1. All right, we are in. Oh, I'm glad I checked. Okay, thank you, Delilah. All right, if you guys can put a 1 in the chat, if you can hear me clearly. And I'll go ahead and we'll knock out hour 3. Great. Thank you, Cicely. Thank you, Morgie times love. All right, great. You guys can hear me. Oh, Joanne, you can't hear me? Letitia has a 1. So Cicely, Morgie, and Letitia put a 1. Joanne says she does not hear me. Doreen does not hear me either. I'm going to wait it out since we're a little ahead of time. On my side, I see that I'm live, maybe. What about now, guys? I hit the live. It says I'm still live. Great. Marceline says 1. What about now, Doreen? Great. Joanne has 1. Okay, and then it says I have excellent connection. All right. I'm going to have to keep an eye on that. Question 1. A client reports that during the past 12 months, they have repeatedly used cannabis longer than intended, made several unsuccessful attempts to reduce use, missed important family activities because of use, and continued using despite frequent arguments with their partner about it. No other substance use disorder criteria are identified. Which diagnosis is most appropriate based on the information provided? A. Cannabis use disorder, mild. B. Cannabis use disorder, moderate. C. Cannabis use disorder, severe. Or D. Cannabis misuse without a disorder. So symptoms are appearing over the past 12 months. Have used cannabis longer than intended, cannot stop or reduce, and has missed important family activities. And she's having arguments about her use with her partner. Great. Thank you, Joanne. All right. I see C. The correct answer is B. Cannabis use disorder, moderate. So B is correct because here we have 4 criteria that are supported. So using longer than intended, unsuccessful attempts to stop or cut down, giving up important activities, and continued use despite having problems and arguments with her partner. That's 4 criteria that has been met, which equals a moderate substance use disorder. A is incorrect because mild will only require 2 to 3 criteria. C is incorrect because severe substance use disorder requires 6 or more criteria. And D is incorrect because the client meets enough criteria per the DSM-5 for a substance use diagnosis. So the pattern goes beyond misuse. What is this question asking? Can you identify DSM-5 criteria in a scenario? And can you identify the severity of the substance use disorder? The skill that's being tested, your ability to identify substance use criteria and determining severity. So for those of you who said they struggle with assessment, you will ask about symptoms and duration and how it's impacting their life. That is how you develop a solid assessment outline format, or you become a skilled assessor, understanding how to get those accurate details out so you can more accurately diagnose if they meet criteria. Question 2. A college student reports drinking heavily on 3 occasions during the past semester. On one occasion, the student received a citation after drinking at a party. The student denies cravings, unsuccessful attempts to stop, role problems, hazardous use, or continued use despite consequences. No additional symptoms are identified. Which conclusion is most appropriate? A. Alcohol use disorder, mild. B. Alcohol use disorder, moderate. C. Alcohol use disorder, unspecified. Or D. Insufficient evidence for alcohol use disorder. So college student drinks heavily 3 different times during the semester, received a citation, does not have cravings, has not tried to stop, or maybe they're able to stop. No issues with family or problems caused by use, no hazardous use, and has not had to deal with consequences because of use. All right. The correct answer is D, insufficient evidence for alcohol use disorder. D is correct because heavy drinking and legal consequence may warrant further assessment, but they do not automatically establish alcohol use disorder. Legal problems are not one of the current DSM 5 criteria. Question 3. A client reports regularly using cocaine. During the past year, the client has repeatedly arrived late to work after using, continued using despite warnings from a supervisor, and spent considerable time obtaining and recovering from cocaine. The client also reports strong urges to use whenever receiving a paycheck. Which DSM 5 TR feature is represented by the client's strong urge to use? A. Impaired role functioning. B. Persistent desire to reduce use. C. Craving for the substance. Or D. Continued use despite problems. Which criteria or feature is represented by the client's strong urge to use? Oh, sorry, guys. Okay, we're back. The correct answer is C. A strong desire or urge to use it meets the criteria for craving. Another counseling skill and assessment skill you need to know to effectively diagnose is hearing what the client is saying and clinically being able to put it in a category. Because remember, our clients might not show up saying, "Oh, I'm craving." They might say, "Oh, I just wanted to use so bad," or "I woke up and I went so long without using, I just had to have a drink," or "I just had to." They won't describe they'll describe their symptoms in a way that may not sound like it meets criteria, but it does. So that's our job, to be able to support them with making sense of these symptoms. A is incorrect because work-related problems may indicate difficulty fulfilling the role, but that's not a specific symptom being asked about, like fulfilling major obligations. That would be the criterion. And B is incorrect because the criteria involves a persistent desire or unsuccessful efforts to cut down or control substance use. And D is incorrect because continued use despite having problems may also be present in the scenario, but it does not describe the client's strong urge to use. What is this question asking? Can you identify specific criterion to diagnose? And the skill being tested is matching clinical information to the correct DSM 5 criteria. Question 4. A client reports recurrent opioid use during the past year. The assessment identifies 3 DSM 5 substance use disorder criteria. The counselor also learns that the client has experienced significant financial difficulties and recently ended a relationship. Neither problem can clearly be linked to the client's opioid use. Which severity level is most appropriate based on the available evidence? A. Mild. B. Moderate. C. Severe. Or D. Unspecified. So the client reports using reoccurrent, so uses over and over again over the past year. They meet criteria, so now you want to identify the severity. So they meet the criteria for the 12 months. That's one. The client has experienced significant. So it's impacting major obligations. So finances, that's two. And recently ended a relationship. Has experienced significant financial difficulties. But it doesn't say why the relationship ended. So I'll give it a strong 2. Symptoms meet 2 of the criteria. The correct answer is A, mild. A is correct because, they say 3. 3 established criteria fall within the 2 to 3 criteria required for mild substance use disorder. B is incorrect because a moderate diagnosis would have to meet 4 to 5 confirmed criteria. C is incorrect because severe requires 6. And D is incorrect because there is enough information to determine severity because 3 qualifying criteria have already been established. So the financial and relationship problems should not automatically be counted simply because the client uses opioids. Okay, so what are the 3? So use over the last 12 months. The counsel also learns that the client experienced significant financial difficulties. Oh, no. So what's the 3 then? The client reports. Okay, so I guess they're going by the assessment identifying 3. Oh, sorry. It says identifies 3. Sorry, guys. What is this question asking? See, you really have to go over the question. Can you separate confirmed diagnostic criteria from general life problems? So they're seeing if we can really accurately diagnose our clients. If some of these criteria, some of the general life stressors and problems can't fall under meeting criteria, because in that event, all of us would be diagnosed. So we should be able to skillfully and accurately diagnose substance use disorder. And the skill being tested is accurately counting supported criteria. Because 2 or 3 things can be true at one time, and they can have several life stressors, several symptoms. They can have co-occurring things going on. And that can be the difference between a mild disorder, a moderate disorder, and a severe disorder. Question 5. A client reports using methamphetamine more frequently and in larger amounts than planned. During the past 8 months, the client has repeatedly tried to stop without success and spends several hours each day obtaining, using, or recovering from the substance. No additional substance use disorder criteria are identified. Which diagnosis is most supported? A, stimulant use disorder mild. B, stimulant use disorder moderate. C, stimulant use disorder severe. Or D, other substance use disorder mild. All right, so let's look at the question. Reports use of methamphetamine. I'm saying it low because last time they froze my live. So it's using more frequently and in larger amounts. That's 1. During the past 8 months, so that's within a year, so that's 2. Has tried to stop, cannot stop, that's 3. and spend several hours each day obtaining, using, or recovering from the substance. That's 4. No additional substance use criteria. I counted 4. Let me go back. Let me see what y'all say. I see B. I see an A. Ooh, this is good. So reports use. Oh no. Take away. It's 12. It has to be a year. So they only meet 3 criteria. See, you got to read it and really be careful. So would not meet criteria for the 12-month time frame. But would it? No, doesn't meet criteria yet because it's only been 8 months. So but does meet criteria for using more and using more frequently and repeatedly trying to stop. So yeah, that will put it at, my guess is A. A is correct. Stimulant use disorder, mild. A is correct because 3 criteria are described: using more than intended, unsuccessful efforts to stop, and substantial time spent obtaining, using, and recovering from the substance. So a mild equals 3. B is incorrect because moderate requires at least 4 criteria. C is incorrect because severe requires 6. D is incorrect because methamphetamine belongs to the stimulant class, so the substance specific category is stimulant use disorder. And remember, you can always go back and reassess. So if someone say, well, it's been 8 months, it's almost 12. Well, if you decide to work with the client, you're always reassessing and screening and updating information. And if while you're working with the client, you reassess again, you can update a treatment plan and it's moderate, or it might go to severe. So that's another area that you need to be, we talked about last week, treatment planning. It's a live document. So we're always doing ongoing assessment. So let's say you start working with the client, they make it to 12 months, they are continuing to struggle with use, they now meet another criteria of the 12 months. What is this question asking? Can you identify appropriate substance use category and severity level? What is the skill being tested? Selecting accurate substance specific diagnosis. So it will be obviously a stimulant use disorder because of the drug. Methamphetamine falls in the category of stimulant. All right, I'm just checking to see if everybody can hear me. I think we're all set. Question 6. During an assessment, a client reports recurrent alcohol use that has caused problems at home. The client acknowledges continuing to drink despite repeated arguments with their spouse, but provides limited information about other areas of functioning. What should the counselor do before determining the severity of an alcohol use disorder? A. Diagnose a mild disorder based on the recurrent relationship problems. B. Assess systemically for the remaining DSM-5 criteria. D. Diagnose a moderate disorder because the consequences are reoccurring. Or D. Delay diagnosis until the client demonstrates motivation for change. Okay, you're doing an assessment, so you're gathering all the information. They report continued alcohol use has caused problems at home, acknowledges continuing to drink, but has limited information about other areas of functioning. Okay, what do you guys think? Do we have enough? Okay, I see B. Is there A? The correct answer is B. Assess systemically for the remaining DSM-5-TR substance use disorder criteria. B is correct because as the addiction counselor, we need to assess the client for the remaining criteria before determining whether a substance use disorder is present and assigning a severity. A is incorrect because one identified criterion does not establish substance use disorder. At least two must be present to diagnose. C is incorrect because the severity is not determined by how serious or how frequent the consequence appears. It's based on the number of criteria met. D is incorrect because motivational readiness to change is not required before a counselor can conduct an assessment or determine a diagnosis. So, what is this question asking? They're asking, do you know what to do when the information provided is not sufficient to determine a diagnosis or severity? And the question to that is yes, we do know. So we know that we do not diagnose without sufficient information, and we continue to reassess. We do not assign a substance use disorder or a diagnosis without having the accurate and complete information to meet criteria. The skill being tested, our information gathering ability, and gathering sufficient diagnostic information before assigning a diagnosis. Question 7. A client reports recurrent cannabis use during the past year. The client has repeatedly failed to complete important responsibilities because of use, has stopped participating in a recreational league, and continues using despite recognizing that cannabis worsens an existing psychological problem. How many substance use disorder criteria are mostly clearly demonstrated? A, 2, B, 3, C, 4, or D, 5. So they're describing symptoms that a client reports. We're being asked how many of these criteria or symptoms that meet criteria are clearly demonstrated. Okay, let's count them. So cannabis use over the past year, that's 1. Has failed to complete important responsibilities, that's 2. And has stopped participating in important life activities, the recreational league. No, the continued use. Okay, so I say 3. The correct answer is B, 3. B is correct because the 3 criteria clearly met is failure to fulfill major role obligations, giving up or reducing important activities, and using despite physical or psychological problems. A is incorrect because this misses one of the distinct criteria described. C is incorrect because recurrent cannabis use itself is not an additional DSM criteria. So the first one would not meet the DSM criteria for cannabis use. And D is incorrect because the scenario does not provide 5 distinct criteria. What is this question asking? Can you identify the separate DSM-5 criteria within a clinical scenario without double counting information? And the skill being tested is learning how to accurately count substance use criteria. So understand what is a symptom and what meets criteria. Question 8. A client reports using prescription stimulants more often than prescribed during the past year. The client has repeatedly tried to return to the prescribed amount without success, and frequently runs out of medication early. However, the client continues to meet work, family, and school responsibilities. Which statement best reflects appropriate diagnostic reasoning? A. And substance use disorder cannot be diagnosed because major responsibilities remain intact. B. The pattern should be evaluated against the full DSM-5 criteria. C. Prescription misuse automatically establishes a mild stimulant use disorder. Or D. Functional stability indicates misuse rather than a substance use disorder. Which statement best describes or reflects the appropriate diagnostic reasoning? Okay, so the client reports prescription stimulant use for more than a year, for a year, over the past year. Tried to take less or return to the appropriate amount, but cannot. Prescribed amount. And then continues to do all the daily functioning. What do you guys think? Let's see. Hi, MVP campaign. I passed my test today in Texas, one and done. Your videos helped me lots. I only studied for a week. Thanks a lot. Thank you. And I shouted you out at the beginning of the live stream in hour 1. But congratulations again. Best wishes on your career journey. What test did you take, MVP campaign? ADC, AADC, NCAC 1, NCAC 2. Okay, so I see some D's. Okay, let's see what we got here, guys. The correct answer is B. The pattern should be evaluated against the full DSM-5 criteria. B is correct because the counselor should assess the client's entire pattern against the DSM-5 before determining whether a substance use is present. A is incorrect because a person does not have to experience impairment in every part of life to meet criteria. C is incorrect because using medication differently than prescribed represents concern for misuse, but misuse does not automatically establish a substance use disorder. Okay. And D is incorrect because maintaining work, school, and relationships does not rule out substance use disorder if other diagnostic criteria are present. So we need more information. We need to check the DSM-5 criteria just to make sure and look at the client's pattern. So essentially it would be misuse, but C is incorrect because just because we see misuse does not rule out a disorder. We would need to check it against the criteria. What is this question asking us? Can you base your diagnosis on DSM-5 criteria rather than how well or poorly the client appears to function? The skill being tested, applying diagnostic criteria objectively and avoiding assumptions about substance use disorder presentation. So again, this is the whole reason why we're studying and reinforcing what we're learning, because Different people will show up differently depending on their life circumstances, what they have access to, cultural differences and expectations. Okay. Question 9. Let's see. Okay, MVP says he passed the ADC and he is taking the NC in December. Best wishes. Question 9. During an assessment, a client describes 5 substance related symptoms. 2 occurred approximately 3 years ago and have not occurred since. 3 different criteria have occurred during the 12-month period. Which information should primarily determine the client's current substance use severity? This is a tricky one. A, all 5 criteria reported crosses the client's substance use history. Across the client's substance use history. B, the 3 criteria occurring within the current diagnostic period. C, the 2 historical criteria because they establish chronic substance use. Or D, the most serious consequence experienced during the client's lifetime. Which one should determine the client's current severity? Okay, let's break it down. Let's break this question down. So we're at an assessment. They describe 5 substance-related symptoms. However, 2 occurred 3 years ago. So let's put those 2 to the side. We have 2 left and have not occurred since. So we have 3 left. And now 3 different criteria have occurred during the current 12-month period. And we know that's one of the criteria. Which information should primarily determine the client's current SUD? What do you guys think? CB. Okay. Let's go through each one. Let's break it down since we got a little leeway. So if we were taking the test, the first thing we look at is which one is just immediately a no. Immediately no A. Because when you're diagnosing, you're not using all like their whole life. Now you can use that information to support them, but when we're actually diagnosing, so considering the use across the whole substance use history is important because it gives you a context of what they've struggled with. But we're talking specifically about substance use disorder. So immediately no A, because 1 does not fit the time frame. Let's look at B. The 3 criteria occurring within the current diagnostic period. I will put B on the maybe, like, okay, because we know the 3 criteria does fall within the 12-month period. So we'll put B on the pile of possible correct answer. C, the 2 historical criteria because they establish chronic substance use. No. Because remember, we have a criteria, we have like a checklist we have to look at in terms of the DSM-5. So just because historically they've struggled, yes, that gives us context, but it doesn't meet the criteria for substance use disorder. So that will be a no for C. And then D, the most serious consequence experienced during the client's lifetime. That would also be no, because consequences does not have anything to do with substance use disorder. So let's see what we got here. The correct answer is B. So if you have a question like this, you might even have a question like a, 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 a more a question that has stronger distractors, like the answers are very close together. Two of them may have been really close. So sometimes you just have to work through it. But the correct answer is B. The three criteria occurring within the current diagnostic period. We know the diagnostic period is 12 months, a year, a year. B is correct because the current substance use disorder severity is based on a number of qualifying criteria occurring within the relevant 12-month period. Three current criteria fall within this range. A is incorrect, like I said, because the criteria from a separate time period cannot be counted. And C is incorrect because historical symptoms remain clinically important, but they do not replace the assessment of symptoms occurring within the current diagnostic time frame. And D is incorrect because severity is not determined by whichever consequence appears to be the most serious. It's based on the number of diagnostic criteria. What is this test asking? What is this question asking? Do you understand how the 12-month time frame affects substance use disorder and severity? Yes, we do. So we know and we understand that the 12-month time frame is a criteria, and in order to diagnose substance use disorder, it has to fall within that 12-month period. And anything outside of that period can be important information to support us in treatment and building therapeutic rapport in the counseling process. However, specifically diagnosing, if it falls outside of that period, we know we don't count it in terms of diagnosing. What skill is being tested? Applying the DSM-5 time frame requirements when determining a diagnosis and the severity. Question 10. A client reports recurrent alcohol use and meets 5 DSM-5 substance use disorder criteria during the past year. The client also reports significant anxiety, but explains that the anxiety began several years before the problematic alcohol use and continues during extended periods without alcohol. Which conclusion is most appropriate? A. Diagnose severe alcohol use disorder because anxiety increases clinical complexity. B. Diagnose moderate alcohol use disorder and further assess the anxiety independently. C. Diagnose alcohol-induced anxiety disorder because alcohol use is currently problematic. Or D. Withhold the alcohol use disorder diagnosis until the anxiety diagnosis is established. Which conclusion is most appropriate? Okay, let's work through it. Reports alcohol use meets 5 substance use criteria during the past year. Reports significant anxiety, but explains that the anxiety began several years before the problematic alcohol use. Okay. And the anxiety continues even when she goes without using alcohol. Okay, I see lots of B's. The correct answer is B. Diagnose moderate alcohol use disorder and further assess the anxiety independently. B is correct because 5 criteria support moderate alcohol use disorder, and it tells you in the first sentence. So this is an example of the question where it gives it to you in the first sentence, but then they go on to add stuff on to give you more context. So it can kind of trick you up. A is incorrect because 5 criteria indicate moderate substance use disorder. The presence of anxiety does not increase the number of substance use criteria. So this is a case of co-occurring, and she meets because it explicitly says meets 5 DSM-5. But they give you more information to kind of not throw you off, but to test your ability to distinguish between the alcohol use disorder and anxiety related issues. D is incorrect. Oh, I'm sorry. C is incorrect because the timeline does not strongly support a substance induced condition. The anxiety predates the problematic alcohol use and continues outside of use. So something can't induce something if it's happening and the substance is not present or being used. And D is incorrect because the addiction counselor does not need to delay an adequately supported alcohol use disorder diagnosis while determining the nature of the anxiety. So you have enough information to diagnose for the alcohol use disorder. So you could diagnose moderately and then further assess or refer out for any additional mental health needs the client might need. What is this question asking? Can you determine substance use severity while recognizing when symptoms may represent a separate co-occurring condition? What skill is being tested? Being able to distinguish the difference between substance use criteria from co-occurring mental health symptoms and selecting the diagnosis supported by the available information. So remember, if you have co-occurring disorders, it has to be treated at the same time. Or if there's a substance use disorder and a possible mental health condition, you still need to address at the same time, and you address the addiction part, and then you refer out for the mental health part. All right, we have completed our 3 separate topics for tonight. Pat yourself on the back. We got through this intensive session. So the key takeaways for our entire 3 hours. Remember, first hour was symptomology or symptoms of use, misuse, addiction, substance use issues. Second hour was pharmacology basics. And then our third hour that we just completed was diagnosing substance use disorders, like identifying the criteria, being able to clinically reason and gather information so we can appropriately and accurately diagnose, understanding how many symptoms or criteria need to be present for a mild, moderate, or severe diagnosis. So our key takeaways for tonight for all 3 topics. First, with symptomology, or understand symptoms of drug use and addiction. You want to be able to recognize the signs and symptoms and patterns you're seeing. Pay attention to things like cravings, impaired control, consequences, changes in functioning. For pharmacology, know your basic drug classes, how they affect the brain, the body, and the risks that come with different substances and drug interactions. So remember, just the basics. Don't overwhelm yourself. Just the basics that we need to know to be able to support our client in recognizing their level of risk. So just good working knowledge of how substances affect our body. And for diagnosing, we need to understand the DSM-5, the DSM-5 criteria, and that we're working with 11 criteria within a 12-month period. At least 2 are needed for substance use disorder. And then determine the severity. 2 to 3 is mild, meeting 4 to 5 criteria would be moderate, and 6 or more would be severe. So, and generally overall, the key takeaway is In all three topics and categories, safety always comes first. If you're reading a question or a scenario and it gives you signs of an immediate medical or safety concern, we always address the immediate safety concern first before anything else. All righty. We have completed our second intensive. We have 2 more left for the month of August, everyone. And you can always watch the playback, review questions, go back, listen to the explanations for each answer. That'll help you identify areas that you need to continue to study, or it may help you identify your strong areas. Let's see. Let's turn the camera back on. All right. Give yourselves a pat on the back, guys. We got through it this evening with minimum interruptions. Thank you guys for holding me down, letting me know about the sound and the connection. Again, thank you so much for supporting the channel. Make sure you are subscribed to the channel so you can see when I post in the community posts. If you need additional resources, you can visit the link in the description. It's in my Stand store. I have a free resource. I have a practice question test, 100 questions. I have a more detailed study guide checklist. And then I have one-on-one availability for those of you who feel like you need one-on-one. All right, guys. I'm going to hang around so we can get our full 3 hours. Congratulations to everyone who passed. I think that's 4. No, it's 3 total. Because MVP came in. I counted him in to the passing over the past week in hour 1. So total for the past week is 3. Thank you, Joanne. I appreciate you. Thank you. You're welcome. I hope you guys have a wonderful week. Hope everyone is well, navigating all the things, all the life stressors, functioning daily and studying. I know sometimes it can be very overwhelming. All right, guys. So same time next week. Remember, for the entire month of August, we are doing the intensive sessions. And then September is recovery month. So I'll be doing, I think 2 lives only for recovery month because I have events to go to. I'm going to do some pre-recorded videos. But October, we're right back at it to our normal once a week, 1 hour. So 2 more intensive sessions for this month, next week, and then the last week of August. And then we'll only do 2 live sessions in October. But you'll also have new videos. I'm starting the 5-minute study series. So there'll be subtopics for recovery month. So there'll be shorter videos and they'll be based on subtopics of the overall general topics. Thank you guys for supporting the channel. If you haven't liked the video, go ahead and like the video. If to be able to tell if you liked it already, the thumbs up will already be highlighted. And that helps us find other study partners. Thank you, Joanne. Thank you, Morgie. Thank you, Brenda. Good night, everyone. Thank you, Letitia. And congratulations again. And I'll be incorporating for those of you who passed. Make sure you visit us. Come back. You are welcome at every live stream. Make sure you come visit us because I'll be posting educational videos towards getting closer to winter. So we'll be incorporating mental health education videos. We'll be incorporating for those of us who've already got certified and licensed. So like clinician tips and reminders, stuff like that. That'll be closer to November, December. Thank you. Thank you, Cicely. Thank you, Joanne. I know that's right. Joanne got the Z's. Yes. I have to get my workout in. I've been consistent. So once I log off, I'm gonna get some dinner. Then I'm gonna get a 30-minute walk on the treadmill. And get ready for tomorrow. All right. If you're on the playback, thank you for rocking with us. Let us know if you're on the playback this far into the video. We appreciate you for rocking with us. That's called discipline. Because you may have not been able to attend the live, but you are here on the playback. That takes discipline because you could have just went to bed. Or you could just skip over this video, but you're not because you're studying to pass. All right. Thank you, study partners. I will see you guys next week.